Good afternoon, everyone, and welcome to our first May Roundtable discussion. We've chosen this discussion because May is Mental Health Awareness Month, and we have some very incredible, very talented and educated guest speakers that are going to be sharing some information with Trina Kennedy, and they are advocates for the Rape Crisis Center. And behind the scenes, doing all the technology and all the magic is Kenisha Jackson. So good morning, everyone, or afternoon, that is, and thank you so much for being here to share with us in this much needed conversation about mental health awareness. Can you all hear me okay?
Yes.
Yes. So what I'd like to do first is I'd like for you to take an opportunity, if you would, to introduce yourself and introduce NAMI Mobile to any of our listeners, so
right.
they kind of have a better understanding and idea of what resources are available for them in our community.
All right. NAMI stands for the National Alliance on Mental Illness, the largest grassroots mental health organization for individuals and families who are affected by mental illness. We have over 600 affiliates across the United States. One of the affiliates is here in Mobile, Alabama. You can go to namimobile.org to find out information about NAMI Mobile, or you can go to nami.org, which is the national website. What we offer is education, advocacy, and hope, as well as awareness. We want to make sure that individuals and families are empowered to find out what mental health conditions are, because it can be very difficult when you're dealing with your loved one and how to navigate the mental health system. That is not anyone's fault when you have a mental health condition, that recovery is possible with the right treatment, and that you can live a rewarding life having a mental health condition. All the resources that NAMI provides are free to the public. We have awesome education classes called like Family to Family that talks about what mental health is, what we need to do to take care of ourselves when dealing with our loved one, resources available, and how to navigate the mental health system. We also have support groups for individuals who are in recovery and for family members who are dealing with their loved ones. We have once a month meeting at Spring Hill Baptist Church Activity Center that meets on the third Monday of every month, except for in December. So you're more than welcome to go to our website, www.namimobile. Oh gosh, I don't believe I just got tongue-tied. namimobile.org, or you can email us at namimobile1@gmail.com. That phone number, we also have a phone number, 251-461-3450. So please visit our website and you can get all the information that you need about NAMI and what we provide.
Thank you very much, Ida. That's a lot of information, and I know that there's some incredible resources out there for individuals or family members of individuals who may be suffering with some type of mental illness.
Yes, and the key word is free.
Absolutely, everybody needs to know that. That's great. Thank you so much for that. I know this wasn't really on the list of prepared questions, but Ida, can you talk briefly about why you think it's so difficult to have these kinds of conversations?
For one, historically, there's been a lot of stigma about having a mental health condition. I would say recently, as more athletes and famous stars have come out speaking about their personal experience of having a mental health condition, that more people have been free to talk about it. But also because of the past 2 years, this pandemic has really heightened about the awareness and the lack of resources available for people who have mental health conditions. I know for me, myself, it was very, anxiety as a result of the pandemic had increased tenfold. anxiety, depression, having the resources to talk to your counselor, in person, all of those things, were kind of iffy during the pandemic and still are. And so it's very important to be aware of how you're feeling, and to connect to someone so that you can get the help that you need.
Thank you so much. I know that that resonates probably with not just everyone that's here today, but with everyone that might be tuning into this Facebook Live. Belle, would you like to take an opportunity to introduce yourself? And then I have a question that I wanted to ask you.
Sure. My name is Val Williamson, and I'm a therapist for Lifelines Counseling Services in the Family Counseling Center. So I provide mental health counseling to individuals, adolescents, adults, families, couples, things like that.
Well, thank you very much, Belle, and welcome. I appreciate you being here.
Thank
My
you.
first question for you, Belle, is twofold. So the first part of it is, can you talk to us a little bit about what is mental health?
Sure. So mental health includes our emotional, psychological, and social well-being. It is something that affects how we feel, how we think, and how we act. It helps to determine like how we manage our stress, how we relate to other people, our ability to make healthy choices. So it's something that's very important in every stage of life, from childhood to throughout adulthood. So yeah, that's what mental health is essentially.
Well, thank you. And now that we know what mental health is, can you tell us what causes mental health issues?
So there is no like single cause for mental illness or mental health issues. There are certainly things that can contribute to the risk for mental illness or mental health issues. Things like adverse experiences in your childhood, trauma, abuse, such as physical abuse, sexual abuse, witnessing violence. There can also be biological factors that can influence, such as chemical imbalances in the brain, genetics play a part. Things like substance abuse, the use of alcohol or drugs can contribute to mental illness or mental health issues. Just going through difficult things in life, going through difficult experiences, feeling, being isolated, feeling lonely, like going through things like the pandemic, what we've all been through, just all of the stressors and changes, that occur in life.
And I want to also point out that having a mental health condition is not anyone's fault. It's not, although all risk factors that she just earlier spoke of, it's not anyone's fault. The main thing is to get help. And it's biological, chemical imbalance in the brain. And so just like you go to the doctor for a physical illness, you break your leg, or you have high blood pressure, you need to go to the doctor to, when your brain is not working. Because like she said, it affects the way you think, the way you behave, and the way you react to others and your environment. And affects your mood. And so all of those things are very important. And when you're having difficulty with those things, managing in your daily life, you need to get some help.
Thank you both for that. We have a Facebook comment, and I am so glad that this comment came in, because I believe that I misspoke and said mental illness instead of mental health. And the Facebook comment was that there is a difference between mental illness and mental health.
Absolutely. So I think a lot of
there
times
absolutely is, and I appreciate that comment.
Well, mental illnesses include disorders such as schizophrenia, schizoaffective disorder, bipolar disorder, major depressive disorder, obsessive compulsive disorder, and panic disorder. But when we're talking about, and all of those things affect the way a person feels, thinks, and how you relate to others and your environment. But when we're talking about mental health, that's kind of a overall thing because it's very important for all of us to take care of our mental health. And so, yes, there are some differences and whatnot, but regardless, you have to be able to know what your stresses are, making sure you get adequate sleep, that you're taking care of your mind, body, and spirit. All, you're connected. The head is not separate from the body. So I think that's what we're trying to emphasize.
Thank you for that. Just hearing what you've given us already, Belle, what are some things that we could do if we have a family member or a loved one or a relative that maybe is suffering with something? What are some things that we could do to maybe help them?
Well, it certainly is important to express to that person, your care and your support, letting them know that you're concerned about them, and that you are there to support them. Letting them know that there are resources available to help them. In that, having mental health issues is something that's very treatable. Reassuring that person that, that you care for them and offering to, help them with things that they might be struggling with in their daily life. Educating other people about, mental health issues and kind of what's going on, ensuring that you are, treating that person with, respect and compassion and empathy. And then, also asking them or finding out if they have, or if they're currently participating in any type of mental health care, do they already, have someone that they maybe need to reconnect with, a mental health professional or a doctor. And if not, then helping them connect, with that type of resource. Now, certainly if someone is in a crisis or needs immediate assistance, or, are concerned that they're in danger of harming themselves or someone else, then it is important to contact maybe, a crisis line, or if you think that, they need to, if they need to go to the emergency room, or if you need to, contact 911 if they are, in danger of harming themselves or someone else.
And again, the earlier you get treatment, the better. I mean, I know even with serious mental illness, 1 in 5 Americans will experience some kind of mental health condition in their lifetime. 25% begins by the age of 14 and 75% by the age of 24. And that's serious. Research indicates that it takes about 11 years from the time a person is diagnosed to the time that a person receives treatment for having a mental health illness. So the earlier that you get treatment, the earlier you get help, the easier it is and the less devastating it is on the whole family. That's the main thing, is that you get and seek treatment, help right away.
Hearing all of that, let me ask, and I'm going to open this up to all of you that are panelists. How important do you feel self-care is for your overall mental health? And what type of self-care, if there is one, do you think would be beneficial to somebody who might be struggling with their mental health?
Some of them we already spoke to. One is being aware, know what your stressors are, and saying no, because sometimes we can overwhelm ourselves. And being able to forgive. I mean, you're not going to be able to accomplish a zillion things in a day. And so you have to know what your boundaries are, accepting limits, getting the appropriate amount of nutrition, making sure that you're truly getting the amount of sleep that you need. Most of us cannot operate just on 4 hours of sleep. Your body has to have a restorative mechanism, and that is sleep. It restores chemically, physically, your body renews itself. So you need to make sure you're getting adequate sleep. So talked about making sure that you eat, exercising. Oh my gosh. Even if just going outside, taking a walk around the block without your phone, put your phone in your pocket and just enjoy nature. Going for a walk, exercising, involving yourself in a hobby, taking a break for something that's just stressing you out. What else that you can do? I guess those are the mainly things that one can do. And talking to someone, you know,
Yeah.
and the one that I love the most, smiling. Oh my gosh, you don't realize how much a smile can lift one's mood. They also have some wonderful things on your phone, like meditation, you know, things like that that can help. So whatever it is that you feel that you can do, that you can, you know, taking a break, counting backward, you know, whatever it is, you know, deep breaths, remaining calm. Those are some of the things that are self-help. That was a lot, huh?
That was a lot, but it was great information. And I think it illustrates how important self-care is. And I know that all of us who are service providers, it's easy for us to preach self-care.
Yes.
And I am very, very guilty of this. And my accountability partner is on this call and she can testify to that. It's easy to preach self-care, but it's difficult to follow through or to make the time for yourself to do it. And it's really not a luxury. And I'm learning that all of the time. So take the time to do those types of things. Katrina or Danielle, is there anything that you would like to add as far as a self-care regime that you have found beneficial?
Thank you, Laurie, for that opportunity. I can say for me, self-care, one of the things that I've learned to do is be okay with not doing anything. As a service provider, you are used to chaos, used to being busy all the time. And we've been told or taught to release some of those things from our plates. Well, it's really hard when you take something off of your plate and then you sit there on the couch looking, saying, okay, I should be doing something. So I've had to learn how to just become comfortable with doing nothing. Even if you have to sit on your hands, it's okay. You don't always have to be busy.
Thank you, Katrina.
I think with that, self-care is something that I really have to really be conscious and make myself do. Being, you know, working full time and being in school and being a single mom, it's very, very easy for me to neglect self-care and myself, period. And I know that's something, you know, that Katrina and Lori both know about me, is that, you know, I don't get enough sleep. I don't exercise enough, but I do, it's easier for me to do the self-care things that I like to do. So I really, you know, try to make sure that that gets done. Like I make sure that I crochet, because it just kind of chills me out. I make sure that I spend time with my kids, you know, and then I try to do the rest of it too, and make sure that I get sleep. And sometimes I just have to put down what I'm doing, if it's homework or if it's work, and just, you know, have a little breath and chill out. So it is difficult to make sure that self-care gets done sometimes.
And also not feeling guilty, right?
Right.
Like, that's the
Right.
thing. We tend to feel guilty when we take a few minutes to just put down the book. Like, I was reading this book last night and I'm tired, right? I really want to go to sleep, but I'm like, I really need to read this book. No, I don't. I don't have to read the book. It'll be there in the morning or tomorrow or whenever I get a chance, because reading shouldn't necessarily be something that's mandated. It can be a luxury. And luxury means that you shouldn't feel guilty about taking those extra few minutes and going to sleep and putting the book down and just kind of resting my eyes.
There's a question in the chat about what can you do to help those who in the workplace with bipolar, ADHD, attention deficit hyperactivity disorder, and personality disorders from escalating at work? For one thing, if they've told you that they have those diagnosis, awesome, wonderful. But if not, you're first of all, you need to just be aware of what that person triggers might be. And if you see somebody, don't, say, hey, I noticed that you're getting upset. Do you need to go to so-and-so, or do you need to do this? Or maybe they, want to just talk to you about it. But we're not here to diagnose anyone. So you have to be kind of careful. But if you see somebody getting upset, you might want to say, hey, I noticed such and such is going on. Do you need to go talk to someone at the job? They have EAP, employment assistance programs that should be able to help you with some mental health things. If that person wants to speak to their supervisor, they should be able to speak to that supervisor, things like that.
Thank you, Ida, for calling attention to that chat question. We have one other comment, and I think it probably relates to the self-care, but Mary said awesome advice. So hopefully she'll take some of that advice on some of the self-care options and not feel guilty doing so. One of the questions that I wanted to ask either Ida or Vel, is there a way that you could prevent mental health disorders?
As the person said earlier, there are many factors that cause having a mental illness: genetics, your environment, stress, post-traumatic, adverse events, biological. So there's not one factor that contributes to having a mental illness. It's due to a chemical imbalance in the brain. And a lot of times we have to get medication along with talk therapy, psychotherapy, along with taking care of your body, exercise, sleep, and all those things that that's individualized based on what's going on with that person.
Thank you. And that part of that, the second part of that question was, are there any cures? And you've spoke to several, maybe not necessarily cures, but several things that an individual can do to help themselves if they're struggling with, with their own mental health.
Right. Typically speaking, there aren't any cures for a serious mental illness, but you have to work at it daily. And that's by taking care of yourself, just like with a mental health condition. Just like if I have high blood pressure, I can either eat healthy or take that pill, or sometimes you have to do both. So you just have to make sure that you're doing what's best for you with the assistance of your doctor and therapist and yourself, of course.
I definitely agree with that. There are, not necessarily cures for mental illness, but there are certainly lots of effective treatments. And people that have mental illnesses or mental health issues can certainly recover and live long, healthy lives.
One of the questions that I wanted to ask, and I'd be remiss if I didn't do so, especially since this is Mental Health Awareness Month. Val, I'm going to ask this question of you. Which, if there is a mental health illness, is associated with the highest risk of suicide or suicidal ideations?
So depression and suicide are definitely, linked. It is estimated that up to 60% of people who complete suicide have major depressive disorder. But that certainly does not include just people with depression who don't attempt suicide. I mean, certainly having depression does not mean that you're going to attempt or complete suicide, but there is a lot of strong correlation in there. And there's also a lot of research that states that, suicide is related to psychiatric conditions, aside from depression, also substance abuse, Psychosis is, I believe, one that has a high correlation to or a higher rate of suicidal ideations and attempts and completions. And then I think, some of the other ones have kind of lower correlations, but even though, many people that attempt or complete suicide have mental health conditions, it's important to note that most people with symptoms of mental health disorders do not complete suicide.
Right. And there are some warning signs when having a mental health condition, such as we typically say, if you're feeling sad or withdrawn for more than 2 weeks, if a person starts exhibiting severe out of control, risk-taking behaviors that can cause harm to themselves or others, sudden overwhelming thoughts of fear for no reason, a racing heart or physical discomfort, seeing, hearing things that aren't there, drastic changes in one's mood, personality and sleeping habits, might start drinking, drugs, intense worries or fears, throwing up, using laxatives. I talked about alcohol and drugs, and trying to harm yourself. Those are some of the warning signs across the board with mental health conditions. So getting, noticing it and letting the person know, saying, hey, not been acting like yourself. What's going on? Don't be afraid to ask the question, because unfortunately, suicide is the second leading, and and suicide is preventable. So don't be afraid to ask the question. If they are posing a immediate risk to themselves or others, don't leave them alone. Get help right away.
Thank you so much for that information. That's incredibly important. Not so much a question, but more of just like an observation comment. There were a few of us, myself, Katrina and Belle. Danielle, I don't know if you were able to make the NAMI walk a few weekends ago, but we participated in the NAMI walk, and I didn't walk due to an injury, so I stayed at our resource table, but that gave me an opportunity to really talk to a lot of folks who came out that day. And I was really struck by the number of stories that I heard about our young people, either attempting or completing suicide. And like I said, it's not, there's not a question in there, just an observation. If Ida or Val, if you wanted to, to comment on that in any way.
It's unfortunate, but yes, you're right. In that young generation, there are more attempts for our young people to do that. But that's why you have to really be aware of bullying and because it's very difficult to distinguish normal behavior from typical growing. Sometimes it can be, and our children are so stressed with trying to accomplish this. They're busy and all that. So parents, you really have to stay in tune with, how your children are feeling. Check in on them. Say, what's going on? If you're like me, I'd be checking backpacks and everything else. It's just so much that's out there, and let them know that, hey, I'm here. You can talk to me, or if you want to talk to me, there is, someone that you can talk to, because suicide is preventable. You don't have to be a statistic.
Thank you. I know that we are getting very close to coming to the end of our time together. I feel like that this conversation could go on for hours. I know that there's so much information out there. I believe that Kanisha is going to share some tips, just some generalized tips and some contact information at the end in the comment section. If there was anything that you could, any wisdom or any advice that you could impart, what might that be? We'll start, how about we start with Katrina?
One thing that I would like to say is, as a strong piece of advice, and this is something that I have to remind myself all the time, is remember to breathe and continue to reach out to the support system that you have. Those are two things that are very important, because we oftentimes forget to just take the time to breathe.
Danielle, do you have any pearls of wisdom that you would like to share with us?
I think the only thing that I want to say is to remember that needing help does not make anybody weak, does not mean that you have failed. It just means that you have something that you need help trying to figure out.
Thank you for that. Val?
I would say, kind of similar to what Danielle just said, it's okay not to be okay. And there's certainly no shame in, admitting that you need help or support. There should be no stigma or no guilt associated with asking for help.
And Ida, we will get your last comments on that.
I would say what all of our presenters just said, and also that you're not alone, that there's no shame, there's no stigma. It's okay to reach out, because oftentimes when we're going through stuff, that's what we tend to do, is isolate. And that's what you don't want to do. So reach out, let somebody know, hey, I'm not okay. I need to speak with someone. Because there are a lot of resources out there, some good resources out there. Again, NAMI.org it has a plethora of information on the website if you need anything. And so just take advantage. And know that you're loved, and that tomorrow will be okay.
Well, thank you all so much for taking the time to speak with us about such an important topic. I know that there is still some societal stigma out there around this issue, and hopefully as we continue to have these types of conversations, that will dissipate. Thank you, Kanisha. She just posted those tips for us. One last thing that I would like to mention is that we do have, Lifelines does have a 24-hour hotline number. If you need anything day or night, 365 days a year, please don't hesitate to reach out to us. That number is 251-473-7273. Again, that's 251-473-7273. And that number is answered by trained advocates 24/7. Again, thank you all so much for joining us. I hope that we could continue this conversation at some point in the future. And we appreciate you. And I hope that you all have a wonderful day.
Thank you.
Thank you.